Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back. If you're just joining us, we are talking about unwanted body moisture, sweating, and body odor. Express Care's Dr. Jitka Lom is here to provide answers and some advice. And of course, we had some questions now. Let's get straight to those. Carmel from Jigo asks, what is the difference between deodorants and antiperspirants?
Great question. So deodorants are there to remove the odor. Antiperspirants have a compound of aluminum in there, where the aluminum salt combines with the sodium chloride, the salt in your sweat, and makes a jelly, and it actually plugs your sweat gland. It actually plugs the hole, so that's the reason you're not sweating. So an antiperspirant is actually a blocking agent, whereas a deodorant is just to remove the odor.
Oh, interesting.
Yeah.
Peter from Tumon writes, when selecting creams, sprays, or other things for excessive sweating or body odor, is there a certain ingredient that he should be looking for?
So yeah, most of them have the aluminum in it, in different combinations of chemicals with big long names. But one thing you can look for is a higher percentage, and you can buy something called Dry Sol, or there's other brands in the pharmacy that have just the aluminum liquid in a 20% solution, and you can apply that. Best time is before bed at nighttime when you're not sweating, so that the pores can be plugged up, and then in the morning time you can rinse it off. And after a couple of weeks of applying it, you will notice that you're perspiring a lot less, and then you can do it just every other day or reduce the frequency, because that is actually really quite irritating to the skin and may cause a rash.
Okay. Now, this is from a Facebook fan. Rob writes, I've had hyperhidrosis for years. I've been sweating in my hands, feet, and armpits for years. At age 40, aside from researching spinal nerve surgery, I've tried almost everything. Any advice?
Well, there's one thing you might not have tried. It's called iontophoresis. It's where you use a low electrical current in a bath of water. There's like a little thing of water with the electrical current. You put your hands in it and you put your feet in it for about 30 minutes per day, and it reduces the sweating. And they also have a device where you can apply that to your underarms. It costs a few $100s, but if you do that regularly, many people have good success. If not, then your other option is surgery.
Okay. Raina, also a Facebook fan, says, is it hereditary? We talked about this earlier, because it seems like it runs in my family. She says, is there anything I can do to control the sweating?
Well, as we said, yeah, trying to stay in a cool environment, try to keep your emotions cool. Some people have tried acupuncture or other balancing methods from Eastern medicine to help them. It might help a little bit, but it sounds like that's what runs in your family.
It's hard to prevent it. Melissa from PD writes, a friend of mine was telling me about a permanent solution to excessive sweating. What exactly are the procedures and how effective are they?
Okay, well, semi-permanent is injections of Botox, botulinum toxin, which actually reduces your sweating for about 9 months. It's a little bit painful, quite painful. Injections into the underarms or into the hands and feet, about 20 shots in each hand and foot.
Wow.
Quite painful, but it does help. The other way to do it is to have a surgery called sympathectomy. Now, beside your spinal cord, you have a parallel nervous system called the sympathetic and parasympathetic nervous system. And these are small bundles of nerves that control the sweating in your body. So a surgery can be done where they make a small incision under the armpit. They go in there and clip the nerves. It can be done through a scope, so there's very little scarring. And it is very effective, over 80% success rate. And people are generally very happy. So that would be a very good a solution for you if you're older and you've tried everything else.
Jason from Manila asks, what certain health ailments can trigger excessive sweating?
Health ailments, well, we talked about the tuberculosis. If somebody has active TB, they're going to be sweating at nighttime. If they have a cancer, they may have excessive sweating at nighttime, lymphoma or leukemia. They might have that along with weight loss and so on. So serious health conditions can go along with sweating.
Okay, our last question comes from Francisco from Maritza. What steps can I take to prevent foot odor?
Okay, well, first of all, let's wash our feet twice a day with good soap and hot water. And then make sure that your fingernail or your toenails are clipped and that you clean under the toenails, because that's where bacteria can hang around as well. Then you need to fumigate your shoes, because they are harboring the bacteria as well. So you can either wash them in the washing machine with a little bit of Clorox, or you can just dip them, put Lysol inside. And one last trick is to put some baking soda when your shoes are drying after work. You might switch your shoes every day and try to wear socks. Try to keep your feet dry.
Some smelly relief. Thanks, Doc, for all of
welcome.
that advice. And Doc will be back again next week where we're talking about bladder trouble. If you have a question, simply send it to healthyliving@kuam.com or post your question on our Facebook page or, of course, on our website. Now, before you go, Doc, we would like to congratulate Dr. Lom and your Express Care staff on your 5th anniversary. So I know this Friday you're going to be having an event at the Agana Shopping Center. Tell us briefly and invite our viewers.
Yeah, I do invite you all. Thank you. It's our 5th anniversary this week, and we're very thankful and grateful that we're able to serve so many people. We'll be serving you cookie cake and having balloons and giveaways, prizes, and raffles, and look forward to seeing you there.
Okay, Doc, and that's this Friday, Agana Shopping Center, beginning at 11 o'clock.